everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare providers to offer body composition solutions. Today, I'm joined with Jeff Young, who's an expert in strength and conditioning and exercise programming, and he's going to be speaking at the upcoming Obesity Medicine Association meeting in Denver about building the bridge between medicine and fitness. And I really wanted to talk to him about that medicine and fitness bridge. And I know that we're going to have a great meeting in Denver, but I wanted to bring that to you in case you can't join us. So thanks for joining me, Jeff.
Thank you so much, Nina, for having me here. And as hopefully you're getting ready to see, I'm very passionate about the topic or topics we're getting ready to talk about. So I'm excited to be here and excited to get started.
Yeah, well, so I think, as a dietitian by training, I feel pretty confident on the nutrition side of the equation as we talk a lot, but I really don't have that exercise experience. And I'm really excited to have you sort of, enlighten us with how that works. And, I want to hear about your talk in Denver. And then I also want to talk a good bit about, the concept of, increasing resistance training, more strength training. We hear this so much lately as we talk about obesity medications and treatment, and this is what people need to be doing. And so I really want to get deeper in that and hear more about that rather than, sort of just these general recommendations that we hear so much of.
Yeah. Well, let me start by saying that, first of all, I'm also excited about, Denver coming up in a couple of weeks and the opportunity to present there. And, in an hour talk, as I know, in an hour talk, like I teach a strength and conditioning course at a local institution here in New York City. And even in 15 weeks, with 3-hour lectures I can't teach everything I want to my students. So in a 1-hour lecture, they're just going to get a very high level overview. And then in our talk today, it's going to be a high level overview of a high level overview that I'm getting ready to talk about in Denver. But just briefly, what I'll be talking about in Denver, is probably like 90% of it is just going to be programming. And first, I'm just going to differentiate between, physical activity and exercise. And then I'm going to dive right into programming and talk about aerobic exercise programming first. My comfort zone is really resistance training. Not that I don't understand aerobic exercise, but resistance training is really my comfort zone. But I'm going to use the handful of slides on aerobic training just to kind of educate people on how you should go about designing an aerobic program, but also to differentiate between, for the lack of a better word or phrase, how it's easier to design an aerobic program because you just follow this FIT VP principle. If you fill in the blanks of the frequency that someone should train, the intensity, the first T stands for time or duration, how long they should be doing aerobic exercise. The second T in this acronym stands for type. Should it be walking? Should it be cycling or elliptical or whatever the case may be, etc. Where with resistance training, it gets a lot more complex, not in the sense that it's hard to understand, but there's way more working parts. Mm-hmm. How many reps should I do? How many sets should I do? What muscle groups should I train? What order? How long do I rest? What's proper form? How do I know what weights to choose? Like there's just so many things. And so I like to compare and contrast and show the difference. And to be honest with you, selfishly or unselfishly, part of the reason why I do it is to show that we need to build the bridge between medicine and fitness. And it's part of the reason why we need to, the interdisciplinary care and to work together and to take advantage of our different areas of expertise. So and then
I'd imagine too, just sorry to interrupt you, but especially in our patients with the disease of obesity, right? They've got a lot of barriers to getting in. Just even walking through the door. I share a story that I joined a gym recently, and when I walked in, it was like I was expecting a lot more hand holding and showing me where things were, and the joke of where's the towels? I thought gyms gave you towels. Well, they don't anymore. And and then I get there, I'm like, well, I don't even know what to do. I work with a company that shows people how lower muscle mass can be. I'm like, I need to be working on that myself. And so I ended up kind of just gravitating to their little mid-range thing that shows you what to do a little bit here and there for 30 minutes. And so I feel like a total novice when it comes to what you're talking about. And I would totally fall into that category of I need something more than just let me follow this little line of equipment down there, because that's not going to really make a big difference, I imagine.
Absolutely. Yeah. And then I'll wrap up my, my presentation by just touching on, how do you connect with what is a qualified fitness professional? What is it? How do you define it? How do you connect with them? Where do you find them? And stuff like that. So, there's a lot to cover in 55 minutes, and leave a little bit of time for some Q&A. But I'm going to do the best I can. So yeah, I'm really excited about it.
Great. And I think too, you may touch on this too, but what are the right terms and language, to use when we're talking, right? So is fitness professionals the right word? I know nutrition professionals, is it dietitian, right? So I know that in my world, we're pretty finicky when we're called the wrong thing. So maybe you can make sure that we're using the right language too.
I'm telling you, man, I could probably spend 10 minutes talking about that, but just a quick response. I'm actually currently co-authoring a paper with the immediate past president, who we talked about before we started recording here, Dr. Amy Bantham.
Yeah.
I'm co-authoring a paper with her and a physician for the Cleveland Clinic that's going to be published in the American College of Sports Medicine's Health and Fitness Journal later this summer. And really talking about like the professionalism of the fitness industry and the need to connect and all that stuff. And this topic came up for the article because there's all these different terms and phrases. And to be honest with you, they just need to standardize. And I don't really even have an answer for you right now as to which one's more appropriate or whatever. I mean, the person would need to understand, are we talking to someone who considers themselves a strength and conditioning coach because they're working with athletes or something like that? And then maybe that's the more appropriate term. Or is it someone who has this degree or certification in exercise physiology, and so they want to be called an exercise physiologist? So you almost need to have that background understanding of where they work, what type of population they work with, and then that might at least lead you to the direction of what the appropriate term is. But yeah, they need to standardize it.
Same thing with behavioral health too. Is it a behavioral health professional? We've got different levels and different credentials, and I do think definitely from a patient perspective, it dilutes it a little bit and makes it harder to know what to do.
Absolutely.
When we're not all on the same page. So we can't, I should hope people know the difference between a nutrition influencer and someone who's sharing, online what they're eating and just doing that for their own reasons, and someone who went to school for a while to get a credential to do that. But it is not the case that it's that easy to figure out even.
It's not. And you're so right. I mean, really, you hit it. It's one thing for us professionals and peers and colleagues to wonder what is the right term. But when we're talking about the consumer, the end user, and all we're doing is confusing them. It's definitely a problem.
Well, so I think, one of my biggest burning questions for you, we should get there in case it takes a while to answer, is, I think a lot about our field in obesity care as we've been, evolving and working towards a more comprehensive approach. And really, I think we're finally getting the message out that people should not be just recommending, hey, just eat less and exercise more, because that's just oversimplified. It doesn't help. And we really need to connect with what does that mean for each individual, and how do we support someone in doing that, and all of that. And I started thinking just how nowadays we're hearing not just eat less and exercise more, but almost eat more protein and do more resistance training, right? Especially, like I said, in the context of obesity treatments that result in significant weight loss. And so I really want to hear your thoughts on, how do we get beyond those simple recommendations? How do we get people into resistance training? There's a lot of, and maybe you can share some of the barriers you've seen, people not wanting to bulk up. That's an old one. I think they think is going to happen much easier than it actually happens. How long does it take someone to really put on muscle? And then in the context of medication and surgical treatments, how do we address that? How do we get people doing what they need to do so that these treatments can be considered, mostly a benefit to their life and not anything with the negative side effects?
Yeah. And again, this is something that you and I could probably talk for hours about, so I'll try to be as succinct as I can with my answer. But I have a virtual business, virtual medical fitness, and the tagline for my business is create an informed consumer. So that's part of my answer to your question. We need to create informed consumers so that they understand in this world we live in with Instagram and TikTok and YouTube, and one says this, and the next says that, and people, portraying themselves as experts when they're not, et cetera. And so how do you create an informed consumer in a world that's just completely divided, with the information that's being put out, and it's really tough. But at the same time, it's my answer to your question. We need to create informed consumers. So, I just feel like from the top down, like at the policy level and at the organizational level, they need to do a better job. Like the leading organizations such as the American College of Sports Medicine and Exercise Science and the National Strength and Conditioning Association could do a better job of disseminating this information to the public through the media or whatever the case may be. So from a top down approach, things need to be better. From a bottom up, I'm not afraid to say that I'm closing in on 30 years being in the fitness industry, and I'm very frustrated with what I see, and one trainer says this, and the next says that. So from the bottom up, we need to have more standardization and people sticking with the principles rather than straying from them and just choosing whatever the method they want, the method of the day or the week or the month or whatever the case may be. So there needs to be a lot of change going on at both ends so that the consumer doesn't get confused as to where do I begin and stuff like that. And then lastly, and really not lastly, but lastly with my answer to your question right for now, is clinicians, across the spectrum of care, whether it's physicians, advanced practice providers, allied health professionals, et cetera. There also just needs to be a level of education, just, at least generally speaking, so that the clinician can understand when they hear a red flag, for example, and to be educated enough to know that with a patient, that maybe you're working with the wrong person, or know that you're being given the wrong information, whether it's through YouTube or the person you're working with or whatever. But the point is, there just needs to be better education across the board to stop the confusion. And exercise is one of the things I'm going to be getting across at the very beginning of my talk in 2 weeks, is that exercise is simple. It really is. It's simple. And we live in this world that's making it way more complex than it needs to be. And so to understand the simplicity of exercise and the simplicity of programming, I don't know if that really answers your question well enough or not, but that's at least the start point, is just education.
Well, and I think, one of the things I think a lot about, again, from the nutrition side, is when we say it's simple, tell me more what you mean by that. It's simple in that, and I think we oscillate between this idea of, well, what's the best exercise to do? The one you will do, right? So we can kind of agree that the getting someone to do something better than they were, moving the needle, moving them closer. So, and then we also don't want to outline something that's so unachievable and, hey, this is what it takes to actually see maybe the results that you want. And then people saying, well, that's way too much. I'm never going to, achieve that. So giving up altogether. There's, I think, a lot of behavior, change and figuring all of that out involved in exercise, just like nutrition.
Yeah. From just like a general workflow standpoint, this, the first thing you want to do is do like a needs analysis, right? And the person in front of you, and just try to get a sense of, like where I like to start is, what is the frequency that you can, how many days per week? Let's just talk about resistance training for a second. Yeah. The first thing you want to talk about is, or to know is, what's the frequency that you can devote per week to resistance training? But at the same time, at least educate and make them aware that if it's only once a week, that's 6 days of rest. So maybe a better start point would be twice. But if you can only start once, then that's totally fine too, because we can always progress. But the point is, start with a needs analysis. The needs analysis typically needs to include or begin with the frequency of exercise, and also what do they have access to? Mm-hmm. Is this going to be a home program, a gym? Is it going to be a combination of the two? And then from there, the needs analysis also need to include things like apprehensions, or movement issues, mobility issues, or something like that. So it needs to start with the needs analysis. And then from there, like you alluded to, we just need to meet the person where they're at.
Mm-hmm.
And because that's something else I'll be talking about in 2 weeks. I call it the familiarization phase. We need to get them familiar with exercise and proper form and the terminology and all that stuff. And me as a coach, I need to become familiar with the person's body and not try to do too much that's going to flare them up or make them lose trust in me or the program, or whatever the case may be. So you really do want to start very conservative on purpose. And then how long that familiarization phase is going to differ from one person to the next. But then from there, you want to just slowly progress, work as a team. Yeah, and that's what I mean by it's simple. There is, once you understand the general workflow, there is a simplicity to start with a needs analysis, meet them where they're at, progress in small tolerable increments, gain the trust, things like that. And then one last thing is that there's only so many components to designing a program. There's only, whether you're a physical therapist or a Pilates teacher or a personal trainer or a strength and conditioning coach, we all manipulate the same variables. Frequency, how often are you going to do it? How many sets are you going to do? You and I talked about this briefly before we signed on. How many sets? How many reps? There's only so many. And once you learn those components or variables and how to begin and then how to progress, there's basically two categories. Where do we begin with those variables? And then what's the optimal way to progress? And then at that point, you just apply those concepts to the person that's in front of you. So there's a lot of little things to learn, just with anything. There's a learning curve. So whether you're a clinician or a personal trainer or the lay person or whatever, you have to understand there's going to be a learning curve. You got to take the time to learn it. But once you learn it, you start to see that, this isn't really that complex.
I love that. Well, it sounds like that patient-centered approach is, woven throughout your field as well. And so to me, that also leads into sort of, who are the professionals that you're working with. You want to find somebody that, just like any field, there's going to be a variety of providers. So you've got to find somebody that you can connect with and that's, approaching it from that lens. And then within that, one of the things that I think a lot about when I talk about, medications and even in surgery is kind of that question of, do we assume that when someone's undergoing a treatment for obesity that there's going to be, when there is significant weight loss, I hear providers talk all the time, there's going to be some loss of lean mass. Do we assume that off the bat? Do we, we have to be realistic and talk to folks about, what's achievable, right? That they're not going to maybe be able to put down a whole lot of muscle mass during a time where they're eating less calories, where they're not able to get in, enough protein, like, some of those factors. And so, but I never really know exactly like how realistic or what time frame does it take to really build up muscle mass, if that's a question that you can answer.
Increasing muscle mass is very volume dependent, how many sets you can perform. It's also intensity of effort dependent. So in other words, if you're only ever doing 1 pound dumbbells and the intensity just isn't high enough, it's like a warm-up set, then you're going to struggle to build muscle mass. And so it's intensity of effort dependent. You need to choose the proper load or weights and for however many repetitions you're doing. So it's tough to answer your question because therefore it's going to be case dependent, right? And how much time the person has and how many sets they can do per session and per week and stuff like that.
And I know that it is. I mean, really, again, if it was that easy to just say everybody do this, there wouldn't be a whole host and variety of professionals. And some things you just need a person there to sort of start you off and get you started. And like you said, if it clicks and they're able to do that on their own, they may be able to kind of move in that direction on their own. But I hear that a lot when it comes to, for us, body composition parameters. We're wanting to show people beyond just what their weight can tell them and look inside and show, hey, here's what's going on with your adipose tissue. Here's what's going on with your muscle mass. And then, of course, the follow-up question is, well, how do I change those? How do I move those in the directions that I want? They know at this point how to maybe make the total weight go down through some of these, treatments, but how do we get more specific into those other parameters and
Yeah.
move them in the direction we want.
I have a little bit of an alternative view rather than for lack of a better word, concern, although it isn't concern, obviously, your muscle mass, and we don't want to lose it. But the way I look at it is, and let's set the disease of obesity to the side just for a second. About 80% of people are not even meeting the minimum guideline, where, no matter what the condition they have, or no conditions at all, about 80% of people are not meeting the minimum guidelines for resistance training. And that's self-reported, which means it's probably a little bit less than that. And so what that means is that, we have norms and we have standards across the lifespan and for males and females of what strength should be in certain exercises. And so to try to make it easy to understand, a person is either going to be average in strength, or they're going to be a little below average, or they're going to be above average. And so one thing that I'm passionate about is that I just feel like we don't know those standards, and we need to know them because they're points of reference. And so the way I look at it is, if your protein intake is adequate and you're on a properly designed progressive program and you're increasing your strength, if you're increasing your strength and the protein intake is adequate, you're going to be putting on muscle. And especially, again, going back to that volume, like how many sets per week, if you're getting in your volume, if you're getting in your intensity of effort, so you're choosing the right weights, and you're getting stronger over the course of time, and then your protein's there, you're going to be increased. So I like to look at it more from that standpoint, just because then from a coaching standpoint, I can say to my clients, since I can't have them do DEXA scans or whatever on a regular basis, I can say to them, see how much stronger you're getting, in this exercise, and motivate them that way. And they're just going to start noticing a lot of times, maybe not all the time, but a lot of times they're going to start noticing the body composition changes as well as they increase their fitness, their aerobic fitness and their strength fitness. So that's how I go about it.
Well, hey, I mean, there is a role for bioimpedance there, because it's not a referral to get a DEXA, but
I'm sorry to say that. Yeah, absolutely.
It could be at point of service.
Talking to the wrong person there.
To me, again, this is where you're sort of connecting the bridge between fitness and medicine. I think that's a really interesting and cool place for body composition testing, because it doesn't have to just be a DEXA scan. It can be in a doctor's office. It can be in a fitness facility. It can be anywhere. And I think that's data and information that would help fitness professionals, until we have the right terminology, help you all to figure out how to make adjustments, right? So if you were able to see those changes, you might be able to make sooner adjustments to what you
couldn't agree more. As a matter of fact, so you add what I said to and merge these two together, and obviously the more metrics you have, the better. So yeah, I couldn't agree more. You have to merge it together, get the metrics, and then notice that as let me just compare this to like programming. One of the things I'll be talking about in aerobic programming is you have two types of intensity, objective and subjective. Objective is when you're measuring your heart rate in beats per minute, and that's a really important metric to have. But subjective is how winded are you, and you want to merge them two together. So using to basically get the most accurate picture. So using that as an analogy, yes, let's merge the body composition testing with what I said and the increases in strength and all that stuff. And then you're going to provide a better picture because you have more metrics. So I couldn't agree more.
I love that. And I think, to me also, that measurement piece is where it's been really interesting in the past couple of years to see us as a field and a community sort of joining together to say, we aren't okay with just measuring weight. There's a whole, this could be, again, lots of hours of discussion on that. But I think everybody's sort of on the same side of, we need more individualized metrics. We need more data points. We need more specifics to say, how do I make changes to my regimen, whatever that may be, based on this information? And so it's been, I think, nice to see our field moving beyond that and being able to then maybe target or personalize these types of things a little bit better.
Yeah, totally agree with you.
So in thinking too about, kind of bridging that medical and fitness, I have you seen it done really well in places that we can look to? Like how do folks get a real community connection? Like, what are some of the things that we can do to make sure that we're not leaving that part out of the equation? I think that's been an area where I don't see enough fitness, movement, exercise at the same level as some of the other professions, even in some of our programs.
You're referring to making that connection with
Yeah,
fitness
like how
professionals?
do we get the medical community to really include fitness professionals in
Yeah,
their treatment plans and go beyond just saying, okay, well, we talked about medication, here's your dietitian, and then, oh, good luck. I think there's a gym down the road. Why don't you go work
yeah,
out and lift more weights or something?
yeah,
How do we get them to get better connected in that community?
yeah. So I'm going to again refer back to this paper that I'm co-authoring with Dr. Amy Bantham and Dr. Matthew Campert from the Cleveland Clinic. I wish the theme and the paper was out right now, so I could just direct people to it, because that's really what we talk about. First of all, the need for connection, and then Matthew Campert gives his view from a clinician standpoint, and then I talk about from the fitness standpoint. But trust. One of the themes of our article is you got to build trust, and the trust is earned, and it's not something that, right. So that, again, these are barriers. So it's kind of a tough answer to your question, but the gist of it is that both sides need to be proactive. Fitness professionals need to be proactive in making connections with clinicians in their local community, and vice versa. So some of it just needs to be both sides will be a little bit more proactive. But one of the things I'll touch on in my presentation in 2 weeks is, and very briefly, is how to vet a fitness professional, and then what qualifications to look for. And again, I can only generalize in my answer to you right now, and also 2 weeks from now. But generally speaking, if I were as a clinician, I would want to have a fitness professional who has a degree in exercise science or related field. And I've been doing this long enough to know that generally speaking, that's the consensus. Most clinicians want to work with trainers who have a degree. And then from a certification standpoint, there's a zillion certifications out there. There are some that are better than others, like the two leading organizations, the American College of Sports Medicine and National Strength and Conditioning Association. But the truth is, you can get whatever certs you want and even whatever degrees you want, and none of them make you an expert. What makes you an expert is experience and the atmospheres you've been working in, and your mentors, and your ability to stay up current with research and stuff like that. That's where the vetting process comes in. And one of the things I'll do in 2 weeks is show a database, a registry. It's called the United States, it's US Reps, USREPS, the United States Registry of Exercise Professionals,
Okay.
which is a database. I think it has like 100,000 fitness professionals throughout the United States on it. So it's a great place to go, but it is not clinician friendly. And one of the things I'll do is I'll compare what you'll see when you go to US Reps. And then the next slide would be what you'll see if you go to the American Council on Exercise, where it has the person's headshot and how long they've been in the industry, and who, what types of populations they are comfortable with training, and what location, and what they charge, and a little bit of a background and stuff like that. That's what's clinician friendly. So again, unfortunately, things are broken right now, and we need to fix them. So what's the answer right now? The answer right now is, from a clinician standpoint, come to my presentation,
Okay.
learn how to vet, or actually just stay in touch with me, whether it's through email or whatever the case may be. Learn how to vet, so at least now you know how to interview them and what questions to ask and stuff like that. And then from there I can just help with, I'm just so connected through the American College of Sports Medicine, National Strength and Conditioning Association. I can actually be a resource to help at least connect maybe in your local area or something like that. So use me as a resource. But also, there's online registries, and you have to learn how to vet the person, so you know what to ask and how to dwindle things down to what you want for your patient population.
That's important. And it also goes to just advocating for better care, for patients through these relationships. So yeah, I think that's important, no matter what type of professional you're getting to support your team. So perfect.
Yeah.
Well, in that same vein, how do we stay connected to you? I know you've got some upcoming projects and papers and books, so I'll be sure to, put those out through our network. But what would be the best way for someone to stay in touch with you?
Yeah, I'll definitely send you the information afterwards. But honestly, email is fine. I don't mind being bombarded with emails. It's JY, and then the word kinesiology is all one word, jykinesiology@gmail.com. And on social media, I'm most active on Facebook. I actually don't do a whole lot on Instagram. I tweet a little bit, but not much. LinkedIn a little bit, but I'm actually most active on Facebook, and I use it as a way to get my brand out there and educate and stuff like that. So Facebook, and I have a group with two clinician colleagues. One's a physician assistant, and the other is a physical therapist. And we have a Facebook group called MRF Institute. It's Medicine, Rehab, Fitness. So in other words, building the bridge between Medicine, Rehab, and Fitness Institute. That's another great place to hang out and get involved in the conversations and ask questions and stuff like that. So that'd be the best ways.
Okay, great. Well, I really look forward to your talk, and hopefully we get a great attendance. I know this meeting's going to be a popular meeting to get a lot of the folks the education they need in the obesity care space. So thanks so much for your time today. And I know we'll be having lots more conversations here in the future.
Absolutely. Thanks so much for having me on, and I look forward to meeting you in person.
Thanks again, Jeff.
All right.
Bye.